Hello, good day everyone. My name is Janica Luis Brun and I will be performing the procedure of the assessment of the head and neck. But before performing any procedure, we need to make sure that we have performed the hand hygiene. And this is my client, Mr. Carl Josh Brun. Mr. Brun, I am Nurse Janica and I will be your nurse for today. The first thing we are going to assess is the head, starting with our hair and scalp. The client's hair is short in length and the color is black with a little bit of white strands. And the character of the hair is wavy and the hairline is just normal. The next thing is we are going to palpate the hair for its texture. The client's hair's texture is a little bit dry. The next thing is examine the scalp for lumps, lesions, and also the presence of infections or infestations. We are going to part the hair in several ways. As observing and by palpation of the scalp, I have not observed any lumps, lesions, or any presence of infections and infestations. The next thing also we are going to examine is the client's scalp. We are going to examine it. The client's skull is round in shape, the size is large, and contour and symmetry seems normal. And then we are going to palpate the skull for nodules or depressions, starting from the frontal to the occipital, and then the temporal. There are no signs of depressions or nodules in the client's skull. And now we are going to move on with the face. We are going to observe my client's facial features. Sir, please frown for me. Smile, puff out your cheeks, and wrinkle your forehead. Facial movements are normal and I don't see some abnormalities. And we are going to assess the eyes, starting with the external structures. First, we are going to start with inspecting the eyebrows. Sir, can you move your eyebrows up and down? Okay. As I observed, the client's eyebrows has an even alignment and the distribution seems normal. And the movement of the eyebrows are normal too. The next we are going to inspect is the upper and lower eyelids while the client's eyes is closed. Please, sir, may you close your eyes. The next to inspect is the bulbar and palpebral conjunctiva to observe its color, texture, and presence of lesions. My patient's bulbar and palpebral conjunctiva has its normal whitish and pinkish color, and there are no also signs of lesions. And next is to inspect the lacrimal glands for tenderness. There seems to be no tenderness or swelling on the lacrimal glands. Next is to palpate the nasolacrimal ducts and assess for blockage. There seems to be no blockage on the nasolacrimal ducts. And now we are going to assess and palpate the inside of the lower orbital rim near the inner canthus of the eyes using my index fingers. The lower orbital rim near the inner canthus of the eyes seems to be normal. And now, using my pen light, we will be testing my client's corneal reflex. Please, sir, please stare straight forward. Okay, the cornea reflex are both reflected on my client's both corneas. Now, to observe my client's movements for each eye. Sir, can I ask you to cover one of your eye with your palm and then the other? As I observe, there are no unnecessary movement or abnormalities on each of my client's eye. And now, as I shine my light again, I will inspect the cornea and lens as for its shape and color of the pupil. Sir, I will shine my light again. As I observe, my client's pupils have normal reaction to light, and the color of his pupils are brown with normal size and symmetry. And also, as observing the pupillary reaction of my client's eyes, it has normal response to light. And now, we are going to test the accommodation of the pupil. Sir, please focus on the object that I am holding. The accommodation of my client's pupil seems to be normal and it can follow the movements I am making. Now we are going to test the visual fields through testing the peripheral visual fields. Sir, please cover one of your eyes with one of your hands. Tell the direction where the object I'm going to put. This one.
Left side,
Upper or lower?
upper.
How about this one?
Right side,
Upper or lower?
lower.
Let's do it on the other eye. This one.
Left side,
Upper or lower?
lower.
And this one.
Right side,
Upper or lower?
upper.
My client has a good performance on identifying through his peripheral visual fields. And now I am going to observe the extraocular of the client. Please, sir, focus on the object while I move it. Next is, sir, please cover your eye with another hand and follow the object again. Okay, let's do it on the other. Next, sir, is I'm going to shine a light again to observe the location of your light reflex. Lastly, we are going to test your 6 primary eye movement. Please focus on the object again. I have observed that my client has very good eye movements when it comes to the object that I am telling him to focus to. And now we are going to test the visual acuity of my client by assessing the near vision of the client, OD and OS. Can you read the cover of the book, sir, with covering one of your eyes?
Media and information literacy.
Can you repeat it on the other eye?
Media and information literacy.
My client is capable on reading on both OD and OS. And now this is a Snellen's chart. We are still testing my client's visual acuity. Please, sir, state the letter or number I'm going to paint into while covering one of your eyes.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D.
And then do it on the other eye.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D.
And now we will assess the nose, but we have to use clean gloves and my pen light. We are going to inspect the external nose using my pen light. Sir, please lean back. My client's nose is large in size. There are no signs of flaring or discharges. My client can read on the Snellen's chart on only some of the letters, but he can still read on the OS and OD. And now we are going to palpate the client's nose to assess for tenderness, mass, dislocation of bones and cartilage. There seems to be no mass, dislocation of cartilage on bones, and no tenderness. And now we are going to assess and inspect the patency of the nostrils. Sir, may I ask you to cover one of your nostrils using your finger? Wait. And the other one. There seems to be no blockage of mucus on the patency of the nostrils. And now, using again my pen light, we are going to inspect the nose for edema, inflammation, excess drainage, redness, and swelling. So can you tilt back your head? There are no detections of any inflammation, edema, excess drainage, redness, and swelling. And now we are going to palpate the frontal and maxillary sinuses to detect structural abnormalities, and as well as percuss the same sinuses to detect tenderness or congestion. There seems to be no structural abnormalities, nor tenderness or congestion on the maxillary sinuses. And the next thing we are going to assess is the ears. We have to inspect the auricle, helix, tragus, and lobule, and check for any lesions, discolorations, or discharges. And also note of the size, shape, and position. Size, shape, and position seems to be normal, and there are no detected lesions, discolorations, or discharges. And the next thing we are going to assess is the external auditory canal for discharges, nodules, or cerumen. Although we do not have an otoscope, we can use a pen light. In this process, you can use this as an alternative, but we do not recommend it since it will imply improper or not accurate results. And also in this procedure, we are also going to note for the color, shape, and consistency of the tympanic membrane. And now we move on to the striking of the tuning fork to test the Weber's test and the Rinne test. Unfortunately, we do not have that kind of resources, so we have to imagine that this is a tuning fork. In the Weber's test, we are going to strike the tuning fork gently on the back of the hand or at the elbows. And we're going to place it on the top of the client's forehead and asks if he hears the sound. And in Rinne test, we are going to strike it again or in the elbows and place it on the mustard process or under the ear and place it nearly and ask if the client hears any more sound. And now we are going to the assessment of the neck. First is to palpate the posterior triangle of the neck for posterior cervical lymph nodes. And palpate the back of the ears up to the chin to detect any anterior cervical lymph nodes. And next is to palpate the left and right carotid arteries. And also the trachea. And lastly, to palpate also the thyroid gland to assess for tenderness or thyroid enlargement. There were no cervical lymph nodes as well as tenderness or thyroid enlargement. And lastly is to ask the client to touch his chest using his chin and then tilt the head from each shoulders and to the back to assess the movements of the neck. My client possesses normal range of motion or movement when it comes to the neck.